Good morning. This is Dr. Buddy Donaldson, and today we're going to talk about reducing the amount of radiation that you get using the iCat FLX CT scanner. The iCat FLX CT scanner that we have is the first of its kind in Louisiana. In the past, we would take 3 X-rays. This is one of them. This is another one. And that's the third one. Each one of those is 25 X-ray units for a total of 75 X-ray units, and that is very low dose radiation. However, the iCat Flex is only 11 total units, so we're actually getting 85% less radiation. Now let's take a look at what the iCat Flex can do for us. Now if we look at the iCat Flex, it is a 3D radiation unit. Now let's take a look at what it can do. Now what we're doing is we're taking a look at the airway right here. For this particular patient, white and blue is good. That's a good airway. Red and black are very small airways. So for this particular patient, the airway is good here, but down here, right in the tonsil area, it's very narrow. So one of the things we look at is the radiation. So that, or the airway, that's what we look for there. Now let's look at something else. The other things that the iCat Flex can do is look at position of third molars. So the third molars would be, or wisdom teeth would be here. This patient did not have any third molars. But what we would be able to do is view the third molars in this area right here for this patient. Another thing that it can do, it can look at your sinuses. So if we take a look here, we're looking at the sinuses here for this patient in a nice black area, meaning that the sinuses are clear. And we can go and look all the way up to the brain, so there's sinuses right up under the brain, and we're looking at that here. Another view that we have is the sinus area here. So we take 2 different views, one here and one here, where we look at sinus areas also for this particular patient. We can also look at the airway here. This is where the adenoids would be, and for this patient, the adenoid area is small. And here is where it was narrow, and this is what's poking out right there, appears to be the tonsils. So if we take a look at the airway here just from another view, this right here, this area that's sticking out the area, and this is sticking out the area right there, that's that patient tonsils. Now, the next thing that we do when I'm taking a look at the iCat Flex, I can also look at the patient's jawbone. So here's a picture of the patient's jawbone. So the iCat Flex will allow us to look at a patient's jawbones, look not only at the patient's airway, but also look here to see if there's any third molars, and we can look at the patient's sinuses. So that's what the iCat FLX does for us. Amazingly, again, this helps produce radiation 10 times the information, but 85% less radiation. This is Dr. Buddy Donaldson. If you have any questions, please give us a call.